So adopting this technique allowed us to do high volume of CAIRS in different stages of keratoconus because we made the procedure much faster and cheaper for the patient. So this is my Trephine that I'm using currently, what I have presented many times. It allows to use the donor rim, allowed us to use any tissue for CAIRS. So we started to do like 3 patients with every keratoplasty case, but after trephining the tissue, I cross-linked the tissue to make sure it is sterilized and stiff before inserting it into the patient. And we shifted from the femtosecond to manual CAIRS again to make the procedure much cheaper. Not every patient can afford the femtosecond price, so we still do a femtosecond CAIRS, but we also do the manual for the patient who cannot afford the femtosecond. So basically, after marking the axis of the incision and the axis of the comma where we will center the CAIRS, we made our incision with the AK knife according to the depth we are aiming to. Then after making sure that the incision on the right depth and on the right plane, we use the tunnel dissector to complete the dissection of the tunnel. Now we are still doing the femto, but for me the manual is faster and cheaper, so I do also the manual rings in general. Now the manual can be better in some cases, not only for the price but also it respect the lamellae of the cornea, so it can be less traumatic to the cornea, especially in those ectasia patient. Now here with the right hand I'm dissecting the tunnel, and I go back and forth to enlarge the tunnel so it can accommodate the segment. Now this segment, you can see it's already stiff, dehydrated, and cross-linked. You can see it looks yellowish because of the riboflavin. Now after inserting the CAIRS, you can see the inferior mark on the comma axis where I center my segment. I already put an ink on the center of the segment to make sure that it is centered. After centering it with the reverse Sensky, I just make sure that the ring in the right place and the procedure has been done. Here you can see the patient on day 1 post-op, and also the anterior segment OCT to make sure from the depth of the segment, and that's it. Thank you.